Hey everyone, good morning. It is Laura here and Jen at Curology Facebook Live. We're here to discuss quite a few different topics today.
Yeah, got some good ones.
Yeah, we're really touching on quite a few things today. Hold you all in suspense for a moment there. Hey, do you want to get going? You want to start?
Yeah, I'll start it off. I've got a question from Basma, and she asks, sunscreen breaks me out. What is a good alternative? Well,
and a
that's
lot of
a
people
tough
have that
question.
problem.
Yeah, they do. And I think the first thing we should say about that is there's two different kinds of sunscreens. There's a physical sunscreen, which is like zinc oxide, and that creates a physical barrier on the skin, which means it bounces the sun's rays right back off of your skin. Those are generally better tolerated, Basma, so I would recommend checking out a physical sunscreen. So look for titanium dioxide and zinc oxide. Those are the two big physical sunscreens. The other thing you want to do is check causedna.com for any comedogenic pore clogging ingredients.
Like our favorite website in the world.
Exactly.
Except for Curology and Sephora.
Yes, those two come first, and then CauseDNA is 3. We are on it multiple times a day, all 3 of these websites.
Yes.
So I'd recommend checking out any kind of sunscreen or any product that you're going to use on your face to make sure there's nothing in there that's going to clog your pores, because if you're acne prone, putting something on your face that's going to clog your pores is just going to make it worse.
Yeah, there are a lot of troublemaker ingredients out there, even when it says, non-comedogenic, not pore clogging. Don't believe that.
Sometimes don't trust it.
Don't trust it.
Check it yourself.
Check it, yeah.
Yeah, be aware of all the ingredients. So I'd recommend physical sunscreen and making sure it's non-comedogenic. In terms of a good alternative, while I don't really recommend any other alternative other than something with sunscreen in it, because that's really what's going to protect your skin from the sun.
Yep.
Some other things you can do in addition to sunscreen would be wearing long sleeve clothing, protecting your skin from the sun physically, so hats, sunglasses, things like that.
I know this topic well.
You do.
Notice the hair and the skin here.
And Nancy does it very well too, Dr. Satter.
Yeah, she does a great job. I don't know if she burns as fast as me. I burn in about 4 minutes. So.
Wow, that's like record time.
I think it is. Like
I
literally.
wonder if anybody else burns that fast.
Yeah, I might be exaggerating slightly, but it feels like it's 4 minutes.
Oh my God.
Oh yeah, well that's a really good topic though, sunscreen, especially for it segues right into anti-aging topics, questions that we get a lot.
Absolutely.
So I was going to, I got a question from Abby about how to manage hormonal acne, which we get this question a lot, and it's a really such an important one because so much of what drives acne is hormonal. So, and there's a lot of things that also affect our hormones and go along with that. So there's a few things really that are kind of staples in managing hormonal acne, and one is really birth control pills. That being said, not everyone can do birth control pills for various reasons, but if your in-person provider feels that you can, let me just say, not all birth control pills are created equal. So you're going to really want to seek out some good advice. We have a good blog post and video on this topic, but generally Yaz or orthotricycline or any of their generics are excellent choices for the skin. So that's number one, really.
And avoiding things like, if you can, levonorgestrel containing birth control pills. The hormonal IUDs too can worsen your acne. But of course, these are good choices for some patients.
Depo-Provera. Really Nexplanon, Implanon in the arm. Those can be real troublemakers. So yeah, Laura's absolutely right. You want to, pills are generally the best. There are other choices that are a little bit neutral. We do have a good blog post, like I said, on that topic to really get the lay of the land. And definitely, if you're a Curology patient, discuss with your provider. Say, hey, what do you think would be a good choice for me? And we can definitely guide you in that area. But your in-person provider also hopefully can really help too. There's also Spearmint Tea. There's been some very promising studies that show that Spearmint Tea actually lowers the androgen hormones in the bloodstream, which therefore lowers oil production, which therefore helps with that hormonal acne.
We get there somehow. Spearmint Tea to hormonal acne. There's a few steps in between, but we get there.
Trust
us, it helps.
Yeah, just trust us when we tell you. But we can provide you info on studies if you'd like it. But anyway, 2 cups of Spearmint Tea a day. If you can get a good organic Spearmint Tea, I mean, it's on Amazon, pretty easy to find. A lot of health food stores. Yeah, Amazon is.
We've got a lot of tea nuts in our office, so people love that stuff.
Amazon's probably our number 4 website.
Oh yeah.
Yeah.
What's number 5?
Yeah.
I don't know. Those are the
we're gonna think on it.
4.
Something to do with shopping. But spearmint tea, 2 cups a day is what was studied and shown to be effective. So, one in the morning, one at night. It's usually non-caffeinated, really well tolerated. And lastly, there is an oral medication. It's an oral anti-androgen. It's called spironolactone. It can be very effective as well. Again, not for every patient.
Right.
Interacts with some medications. You'd really want to ask your provider, whether it's your Curology provider or your in-person provider, about if that might be a good option for you for treating hormonal acne.
Yeah.
So.
And that's something like birth control pills you would take every day for an extended period of time versus like we've discussed antibiotics here in the past, which is usually from maybe 1 to 4 months max or so.
Right. Whereas birth control pills and spironolactone are really kind of thought to be long-term medications until your body's own susceptibility towards acne sort of passes, and that age range generally varies quite a bit. But so you think of it more as a long-term medication.
Yeah. I think another thing about hormonal acne too, we get a lot from patients asking about what topical things can help with hormones, and unfortunately there's no topical products that treat hormones themselves, but things like Curology medications and other acne medications can help treat the other aspects of it. So inflammation, bacteria, those other things. So many women with hormonal acne do just fine with topical treatments alone.
Yeah, that's a really good point.
Yeah.
I mean, I've seen really tremendous turnaround on a lot of patients when they're just using a topical. So, you definitely don't have to rely on any of those other options, but they're nice. It's nice to start with your topical, and then, if needed, add on. That's generally how I approach it.
What
do you
options.
think? Yeah, there are options. Yeah, good.
I totally agree.
Awesome.
I'll move on to our next question from Loretta, and she asks, what are your thoughts on the face oil trend going around lately? It seems like everywhere I turn, someone is raving about face oils, from pricey brands such as Sunday Riley to DIY face oil combinations using rosehip, grapeseed, etc. So
this is a
great
big
question.
trend right now.
It is. We see a lot of patients asking us about these, and actually I'm a fan. I don't know about you, but I like face oils with some stipulations, and bridges into another question that I have coming next about coconut oil, which I will say, keep that in the kitchen. Coconut oil, stay away. Don't put it on your face. Don't do anything with it on your face, but that oil in particular is not good to be used for the face.
Right.
But things like rosehip oil, which I actually have a sample of here, jojoba oil, grapeseed oil, like you mentioned, Loretta, are all great to use. And you can use them either solely, so by themselves, a couple drops. You can add a couple drops to your moisturizer.
Yeah, make it a little more moisturizing. Absolutely.
People are also doing their own kind of compounds, so putting together different oils to make a combination. So a couple drops of this, couple drops of that. I'm sure it works okay.
People are so adventurous.
Yes. So I'm a fan. I think it's great. I think the things you just want to make sure, again, this is our theme, make sure it's not going to clog your pores.
Right.
And number 2, make sure that if you're going to use a serum and not a actual pure oil like the rosehip oil, you want to make sure there's no hidden ingredients in there that are going to clog your pores.
Going back to our third favorite website.
Yes.
CosDNA.
CosDNA.com. If you're all learning what our favorite websites are today.
There
will be a quiz at the end of this.
Absolutely right. That's awesome.
Yeah, I think that's it for my questions.
Great. Yeah, that's a good one, though. Well, I got a question from Julia, and she was saying she's been having a lot of bumps on her forehead. They seem to come out of nowhere. They don't go away. It's been years, and it can't be acne. What is it, and how can I get rid of them? So there's several culprits here. Oftentimes when we see a lot of little uniform bumps on the forehead in particular, we think of a fungus called pityrisporum. And in that case, a zinc bar soap can be super handy, really good to get rid of all those little bumps that you think are never, ever, ever going to go away. Zinc soap, it's zinc pyrithione. It should only be used 2 to 3 times a week. It can be quite drying, actually. Not in everybody. Some people tolerate it every day. And you usually can tolerate it every day on your body if you have in your back. Someone laughing over here.
Sorry,
I think it's because of her question.
David.
Yeah, I'll get to.
We'll get to your
answer
question.
the viewers' questions in a minute.
That is a good question. I'm going to leave that to Laura. But zinc bar soap, very handy for those bumps on the forehead at times. Really good for acne on the back too. But like I said, on the face, 2 to 3 times a week. Also, it really depends the cause, but an AHA or BHA, BHA is salicylic acid, AHAs include lactic acid, glycolic acid, mandelic acid. They can also be really helpful. It kind of depends on your skin type, and sometimes you need to just try one, try a low strength of it, see how your skin responds. My skin responds really well to glycolic acid. I think I shared with you all last time.
I can verify that.
I make her touch my face because
it's still so smooth, just like it was 2 weeks ago.
There we go. So, my skin responds really well to AHA, but some people respond better to BHA. So you'd want to just start low, start gentle, see how you respond. But that can kind of help those really stubborn little clogged pores sometime that, as you mentioned, Julia, just never seem to go away. So, a combination of the zinc and maybe one of those might be helpful. There's some masks that are really good. We really love the Queen Helene Mint Julep mask. I love that one especially. It's kind of like this nice little tingle, nice smell, not irritating.
Also super inexpensive.
Yes, super inexpensive. Yeah. I know. I wish I brought in the little thing for you. If you go on Amazon, you'll see it's definitely, under $10. It's and it's a kind of a large bottle of it. It lasts a while. And it just feels really nice on your skin, kind of gets out some of that gunk a little bit that's sitting on the surface. But then, of course, we get into the actives, which are in a lot of our curology medications, azelaic acid, tretinoin. These are really, I can't live without them. So that and the glycolic acid, obviously they do a great job of kind of getting deeper in and clearing the pores out, and actually speeding up cellular turnover so that the pores don't get gunked up like they do. So it's kind of a two-step process there, but either or azelaic acid and tretinoin, or in combination, can be really handy. You just need to make sure that your skin is ready for those ingredients. If you have a lot of inflammatory acne, cystic acne, it may not be the time to add those in because it can all just make things a little bit more inflammatory at once.
Yeah.
Yeah. So, hey, what about that?
What about that question? So Dave's asking, any sunscreen recommendations for a bald man? Okay.
Yeah.
Well, I have a few suggestions for bald men, particularly bald men who like to go surfing in the sun.
Do we know anyone?
I think I know someone who likes to do this. His name is Dave.
So weird.
And I would recommend a use of a water-resistant sunscreen, a high SPF, because you're out in the sun for long periods of time and going in and out.
Yeah,
in the water.
The reflection of the water.
Yep, and also wearing hats in the sun. Not while surfing, but wearing hats for bald men.
Can you not wear a hat while you surf?
I don't think that works out.
I am not a surfer.
I don't think that works out very well.
I mean, that would be good, though. They need to make some sort of, surfing cap.
They should. Maybe they do, and I just don't know.
I'm pretty sure.
I need to find it
if
for him
not,
for Christmas.
This is my $1 million idea. So there we go. I'm going to take off of this.
So, Dave, please wear sunscreen.
Please, Dave.
On your bald head.
Wear sunscreen. Okay.
All right. I think we're done for today.
Yeah, I think we are done for today. We have just jabbered on, haven't we? Well, thank you guys so much for joining us. We'll see you next time. I'll make Laura touch my face again. And happy Thanksgiving.
Happy Thanksgiving, everybody.
Thanksgiving.